We will provide the latest update on national epidemiology with a focus on the longer-term management of COVID-19 and preparedness for the future. For more than 2 years, the COVID-19 pandemic has had a profound and significant impact on the health, social, and economic well-being of people in Canada and globally. Thanks to our collective whole-of-society response, we have learned more about how the virus behaves, and we are better equipped with new tools, including diagnostics, a portfolio of 6 Health Canada authorized COVID-19 vaccines, and more treatment options. Together, these tools can help reduce the impact and severity of COVID-19. We're now in a period of transition, and we anticipate that progress will not be linear, and that there will likely be more bumps along the way, including resurgence in cases this spring, and likely also in the fall and winter. However, with higher levels of population immunity, proven protective practices to slow the spread and reduce pressure on the health system, we are in a stronger position to get back to more of the things we love, while continuing to keep each other safer. Nevertheless, as we take steps to recover, address the broader impacts of the pandemic, and actively prepare for a range of future scenarios, we're all encouraged to keep vaccinations up to date and continue with the personal protective measures like masking.
Bonjour. Aujourd'hui, nous ferons le point sur la situation épidémiologique nationale.
Providing the latest update on national epidemiology with the focus on the longer-term management of COVID-19 and preparedness for the future. For more than 2 years, the COVID-19 pandemic has had a profound and significant impact on the social, health, and economic well-being of people in Canada and globally. Thanks to our collective whole-of-society response, we have learned more about how the virus behaves, and we are better equipped with new tools, including diagnostics, a portfolio of 6 Health Canada authorized COVID-19 vaccines, and more treatment options. Together, these tools can help reduce the impact and severity of COVID-19. We are now in a period of transition, and we anticipate that progress will not be linear and that there will be likely more bumps along the way, including resurgence in cases this spring and likely also in the fall and winter. However, with higher levels of population immunity, proven protective practices to slow the spread and reduce the pressure on the health system, we are in a stronger position to get back to more of the things we love, while continuing to keep each other safer. Nevertheless, as we take steps to recover, address the broader impacts of the pandemic, and actively prepare for a range of future scenarios, we are all encouraged to keep vaccinations up to date and to continue with the personal protective measures like masking.
Slide 1. Following the last update in February, jurisdictions across the country eased public health measures. Not unexpectedly, the associated increase in in-person activities, more transmissible BA.2 variant, and waning immunity may have contributed to increases in transmission, as reflected in recent trends in daily new case counts, laboratory positivity, and other indicators of increased virus circulation. As of March the 31st, daily average case counts have increased by 28% nationally, indicating a resurgence is underway. Currently, declines in lagging indicators of severe illness are leveling off. As with disease activity indicators, these trends show considerable variability regionally and are likely to follow the rising trends of cases to some degree over the coming weeks. Over the same time period, surveillance activities have been shifting from reporting every case to monitoring key trends at the population level, with reduced frequency of reporting. As we continue through this transition phase, we need to further build on the range of surveillance activities that were established and enhanced throughout the pandemic. These will continue to support early warning and ongoing monitoring of disease activity, while being adapted for longer-term sustainable disease monitoring.
Diapositive 2.
Slide 2. While trends remain low, declines in hospitalizations have slowed in some jurisdictions while others show signs of increase. While we could see some further increase in hospitalizations over the coming weeks due to high population immunity from vaccination and recent infection, the impact on our healthcare system could be more manageable. This is important, as keeping the impact on hospitals at manageable levels remains critical as part of the ongoing recovery in order to focus on delayed or postponed care and the broader health impacts.
Slide 3. As part of a comprehensive surveillance approach, examining wastewater trends can help us understand patterns of COVID-19 transmission in our communities. This approach has several important advantages, including potential to act as an early warning system, providing a source of data that can help estimate the burden of COVID-19, as well as identify virus variants circulating in communities. While some sites are currently showing rising virus levels in community wastewater, there's variability across testing sites. For example, recently reported community wastewater data signal a rising trend in a number of local areas, such as Ottawa, while there are signs of declining signals for several sites in Saskatchewan. With information like this in hand, people may be encouraged to adjust their use of personal practices, such as masking, to protect themselves and others. It is important to remember that no single source of information can tell the whole story. Going forward, it will be important to continue to monitor a range of surveillance indicators.
Diapositive 4.
Slide 4. While over 81 million doses of COVID-19 vaccinations have been administered to date, there are still opportunities to close vaccination protection gaps. Over 5.1 million eligible Canadians need one or more doses to complete their primary series. In particular, vaccine coverage for first doses among those aged 5 to 11 has plateaued at 57%, increasing only 1% over the past month. While additional dosage coverage is high among those 70 years and older, coverage has slowed in those aged 50 to 69 years of age, who are also at higher risk of hospitalization and critical illness. It's not too late to get a booster, and with the recent increase in cases, this is particularly important for those aged 50 years or older who are not up to date with their COVID-19 vaccination.
Slide 5. Over the longer term, COVID-19 activity will depend on a range of factors, including waning immunity. Therefore, ongoing monitoring of COVID-19 vaccines' impact can support vaccination programming going forward. Since vaccines became available, hospitalization rates have been consistently lower among fully vaccinated people and those with an additional dose compared to unvaccinated people. From mid-February to mid-March, vaccinated people continue to be at lower risk of hospital admissions than unvaccinated, with a hospitalization rate that was 4 times lower among fully vaccinated people than among the unvaccinated people, and 10 times lower among fully vaccinated people with an additional dose than among unvaccinated people. Getting an mRNA booster dose remains important for enhancing your overall immune response, which can provide longer-lasting protection and possibly better effectiveness against variants.
Diapositive 6.
Slide 6. Currently, we are using multiple sources of information to monitor the evolution of the virus. This includes random testing of arriving travelers, partnering with provinces and territories to sequence viruses in Canada, and, as described above, conducting wastewater surveillance. To better understand the situation outside of Canada, we are also closely collaborating with international networks on genomic surveillance. A recent experience with the BA.2 sublineage of the Omicron variant provides an example of how these systems work. By monitoring the virus sequences within the country, including in wastewater, we are seeing a steady increase of BA.2 as a proportion of sequences. It is possible BA.2 may be more of a concern for Canadian regions and communities that had a smaller BA.1 Omicron wave and or have lower booster coverage, as these areas could experience faster spread of the BA.2 sublineage. While BA.2 is more transmissible than BA.1, it seems to have a similar severity and symptom profile. And up-to-date COVID-19 vaccination, including a booster dose, is still expected to provide substantial protection against severe outcomes. Furthermore, infection with a BA.2 within 2 months of a BA.1 infection is rare. As a result, while it is possible we could see an increase in cases and severe outcomes associated with further spread of this highly contagious variant, we have not yet seen the rapid acceleration of BA.2 observed in some countries internationally.
Slide 7. Globally, some countries that passed the peak of the Omicron wave have since begun to see signs of a resurgence. Canada has been closely monitoring the situation in these countries, particularly as it relates to the spread of the BA.2 sublineage. Predominance of BA.2 appears to be common among countries currently reporting a resurgence of cases and in the context of less stringent public health measures. This cautions us in Canada to continue to prepare for further ups and downs of the trajectory, including the spring, as BA.2 continues to spread and in light of reduced public health measures. This is why we are urging people to continue with our vaccines plus strategy by keeping vaccines up to date, following public health advice, and maintaining good personal protective habits.
Diapositive 8.
Slide 8. COVID-19 will be with us for the foreseeable future, and while there is significant uncertainty on the specific trajectory as the virus evolves, there are 2 key scenarios we are preparing for going forward. A likely scenario could be one in which we have a low to moderate ongoing virus transmission in Canada with intermittent waves as new variants emerge or immunity wanes. While this type of transmission could sometimes result in rising case counts and severe outcomes, the impacts on the healthcare systems could be more predictable and manageable without the need for restrictive public health measures. In parallel, we are monitoring and preparing for a less likely but still possible worst-case scenario involving the emergence of a variant of concern that has both the ability to evade prior immunity, including vaccines, and cause more severe disease. This scenario could result in substantial strain on the healthcare systems, necessitating both personal protection practices and public health measures, potentially including those that are more restrictive. While we need to be prepared for a worst-case scenario in the near term, our most significant risk may be a resurgence that coincides with the return of other seasonal respiratory viruses, including influenza, this fall and winter, resulting in a substantial impact on health systems. This is why now is a crucial time to focus on preparedness in addition to recovery, and why all levels of government are working together under federal, provincial, and territorial public health for ongoing management of COVID-19.
Time to recover. In light of potential scenarios, we are transitioning to sustainable management of COVID-19 at the same time as we're preparing for future waves, including a worst-case scenario. Fortunately, Canada's overall high vaccination coverage, together with public health measures and adapting our daily routines, have provided us with better protection going forward. Although further ups and downs are not unexpected over the coming months, we can continue to rely on a suite of tools we have for prevention, surveillance, and response, including vaccines, testing, treatments, and public health and healthcare infrastructure. For public health and individuals alike, maintaining a caution and a state of readiness will be our strongest advantage as we prepare and enhance our surge capacity for future response. Measures to reduce transmission will continue to be important, particularly in high exposure risk settings and around vulnerable populations. For individuals and families, this includes keeping COVID-19 vaccinations up to date, including getting a booster dose when eligible, being aware of our evolving risks in our community, and maintaining individual protective practices such as wearing masks, staying home when sick, and improving ventilation of indoor spaces. In particular, as Ramadan, Passover, Easter, and other important events approach, considering the risks and planning safer ways to celebrate, but continuing to use good personal protective habits can help keep us all safer and collectively reduce the risk of large spreading events. For the ongoing efforts of countless Canadians in protecting each other, thank you. Merci. Megwidge.
Diapositive 9. À la lumière des scénarios possibles, et bien que nous soyons
Slide
dans
9.
une période
While
de
this is a time
récupération,
to recover
nous
in light of
effectuons
potential
une
scenarios,
transition
we are
vers une gestion
transitioning
durable de
to
la
a
COVID-19,
sustainable
et nous nous
management and at
préparons
this
en même
time
temps à
preparing
affronter des
for
futures
future
vagues,
waves,
y
including a
compris le
worst-case
pire des
scenario.
scénarios. Heureusement, la couverture
Fortunately,
vaccinale élevée au
Canada's
Canada,
overall high
ainsi que les
vaccination
mesures de santé
coverage,
publique
together with
et
public health
l'adaptation de
measures
nos
and
habitudes
adapting our
quotidiennes
daily
nous
routines,
assurent une
have
meilleure
provided us
protection
with
pour
better
l'avenir.
protection
Même
going
si nous
forward.
pouvons nous attendre à
Although
d'autres
further
faits
ups
hauts
and
et
downs
bas
are not
dans les mois à
unexpected
venir,
over the
nous
coming
pouvons
months, we can
continuer à compter
continue
sur
to rely on a
l'ensemble
suite
d'outils
of tools
dont nous
we
disposons
have
pour
for
la
prevention,
prévention, la
surveillance,
surveillance
and
et
response,
l'intervention, notamment les
including
vaccins, les tests,
vaccines,
les
testings,
traitements et les
treatments, and
infrastructures de
public
santé
health
publique
and
et de soins de
healthcare
santé.
infrastructure.
Tant pour la santé publique
For
que pour
public
les
health and
particuliers, le
individuals
maintien de
alike,
la prudence
maintaining
et
caution
de
and a
l'état
state
de
of readiness will
préparation
be our
sera
strongest
notre
advantage
meilleur
as we
atout au
prepare
moment
to
où nous nous
enhance our
rétablissons
surge
et
capacity
renforçons notre
for
capacité
future response.
d'intervention future. Les mesures visant à réduire la
Measures
transmission
to reduce
resteront
transmission
importantes,
will
en
continue to
particulier
be
dans les
important, in
endroits à très
particular
haut risque
where there are high
d'exposition
risk
et en
of
présence des
exposure
populations vulnérables.
and where
Pour
there are
les
vulnerable
individus et les
populations. For
familles, il s'agit
individuals
notamment
and
d'avoir sa vaccination
families,
contre
this
la
includes
COVID-19
keeping
à jour
COVID-19
et
vaccinations
d'obtenir
up
un
to
dose de
date,
rappel
including getting a
lorsque
booster dose
admissible,
when
d'être
eligible,
conscient des
being
risques qui
aware of
évoluent
evolving
dans nos
risks in our
communautés et
community,
de maintenir
and
des pratiques
maintaining
de
individual
protection
protective
individuelle,
practices,
comme porter un masque,
such as wearing
rester à la
masks,
maison
staying at
lorsque
home when
vous êtes
sick,
malade
and
et
improving
améliorer la
ventilation of
ventilation
indoor
intérieure.
spaces.
En
In
particulier, à
particular,
l'approche de
as
Ramadan, de
Ramadan,
Pâques et
Passover,
d'autres événements
Easter, and
importants,
other
le
important
fait de
events
prendre en
approach,
compte les risques et de
considering the
prévoir des
risks
moyens
and planning
plus
safer
sûrs de
ways to
faire la fête
celebrate by
en continuant
continuing
à
to use
utiliser de
good
bonnes
personal
habitudes
protective
de
habits
protection personnelle
can help
peut
us
contribuer
all
à nous
and
garder
keep us
tous
all
en
safer
sécurité et
collectively
à réduire
and reduce the
collectivement
risk of
les
large
risques d'événements
spreading events.
conduisant à une transmission importante. À tous les
For
Canadiens
the
et Canadiennes
ongoing
qui
efforts of
continuent de
countless
prendre des mesures
Canadians in
pour
protecting
assurer la
each other,
protection de tous, thank
thank you,
merci,
merci,
miigwech.
and miigwech.
Thank you. Merci beaucoup. We now go to questions. The first person who will be asking a question is Dylan Robertson from the Winnipeg Free Press.
Dr. Tam, you mentioned a shift from reporting every case to monitoring key trends, but that shift seems unparalleled among our peer countries. When we look at the per capita number of tests being performed, Canada is way at the bottom of the 38 countries of the OECD. I wanted to know if you're comfortable with that happening on your watch.
I think as you know, the tests were being done by provinces and territories. From a federal perspective, we have supported capacity building, provided and many other resources and other supports to provinces and territories. We know that at the peak of the Omicron wave, even though health systems were stretched, provinces were able to surge to, I believe, even up to 150,000 tests a day. We're at about 40,000 tests a day on average. I can't tell you whether that's too much or too little, but it needs to be enough so that we can monitor trends of things going up and down. And certainly I will be encouraging provinces and territories to continue to sustain that infrastructure as well as offering tests to their populations. I know that it was a very difficult task during the height of the Omicron wave to provide that response. And so I think I think the jurisdictions are adjusting to what is a good sampling size and distribution in terms of trends analysis. So, which is why we have also added in supports for wastewater monitoring, because we know, just like other respiratory viruses, not every person will present for testing. Some people may have done the rapid test and, that's not counted. And so adding in another layer of surveillance will give us more information so that the public can know what to do. So it's not just one system, but many that needs to be strengthened, I think, at this time.
Thanks for the thorough answer. And another question on data. You mentioned collaboration with the provinces to get consistent data reporting. We have seen a bit of what appears to be a reversal. Manitoba changed the definition of a COVID death for the first time in 2 years. There's other provinces that are modifying their key indicators. I think this is actually your first modeling report that has no Manitoba data, which I have to assume is the result of the province pulling the plug on most of its surveillance. Should we be concerned about a backtracking here if we can no longer consistently compare the data sets with the past figures or between the provinces?
Yes, we haven't shown every single jurisdiction, so that data is either on our website or can be provided. But yes, so the provinces are all trying to find their, steady state or sustainable surveillance approach. But it is important, I think, to maintain that, as I've just said in my previous answer, to maintain that capacity. And I meet with, as you know, the provinces all the time, very frequently, to try and get that more consistent approach and get the definitions so that we can report more consistently. So we are continuously trying to improve and see where we can end up in terms of our sustainable approach going on. I think things like mortality surveillance is very important. And I personally think that in the Canadian context, we need to do better. During the pandemic, we learned to be more real-time. We live with imperfections and with some variability in how we report because we have to be more timely. I do think now taking some time to arrive at what might be a good, consistent approach would be very important. I'll be really disappointed if we went backwards and let go of the actual gains that we made during this pandemic. And I look forward to working with my colleagues to make sure we're strengthening that kind of reporting going forwards.